In Module 2 of iView charting, we'll take a look at the basics of entering information via the iView. Before we begin practicing with entering data onto the iView, let's look at how the columns are set up. Unless you work in a critical care area, the default setting for the times in your iView column is actual time. This can be changed to an interval view if you desire, but generally it is best to leave this setting as is. To change to an interval view, the mouse is positioned in the time-date region and right-clicked. This will reveal the various intervals that may be selected. Note that this function will not work if you have entered any data into any of the fields in the column, even if you have cleared the field. If you've cleared all fields and want to change to an interval time view, you must click the Cancel button to enable the function. However, again, it's generally best to leave this setting in its default form. The column furthest to the left represents the current time. On occasion, it may be necessary for you to create a column to enter data that was collected or performed earlier but not entered into the chart at that time. To do this, you may either right-click in the Date Time area and click on Insert Date Time, or click on this icon. This will then open a box that will allow you to specify the correct date time for the information you need to enter. After entering the date time, click anywhere outside the box to see the new column. Now you give it a try. Create a new column for some data that you need to chart for 8 o'clock a.m. Use the date time icon to begin. Now enter 8 o'clock in the time field and press the Enter key. Now let's enter information onto the chart. To enter an individual result, simply locate the label under the appropriate section and double-click in the corresponding cell underneath the current time. Fields will open differently depending on the type of data to be entered. For instance, temperature is a free text field. Double-click in the temperature cell and type in a temperature of 99.2, then press the Enter key on your keyboard. Notice how the temperature you entered appears in purple font. This indicates the value has been entered but not yet signed. Now let's look at a different type of field. The temperature route field is a single choice field. Double-click in the temperature route cell underneath the corresponding time column and choose Oral from the list. The oxygen delivery field is a multiple select field. Double-click in the oxygen delivery cell underneath the first time column and choose High Flow Oxygen and Non-Rebreather Mask. Then hit the Enter key on your keyboard. Often, rather than entering data in a single cell within a section, you'll want to fill in several cells. A quicker way of accomplishing this is by activating an entire section for charting. For instance, let's say we just took this patient's vital signs and we want to enter several results. To do this, we'll open the whole vital signs section. This is done by double-clicking in the cell next to the section title, in this case vital signs, underneath the current time column. Now each cell within this section may be filled in quickly without having to double-click in each individual cell. To move between cells after entering data, either hit the Enter key or the Tab key on your keyboard. If the cell is one with a drop-down list, such as a multiple choice cell, clicking the X in the upper right-hand corner of the box after making your selections will also advance you to the next cell. Once charting is complete for the current time column, the documentation is signed by clicking on the checkmark icon located here. Now you try. Double-click the cell next to vital signs to open this section for charting. The patient's temperature is 100.2 degrees. Enter it now and then press the Tab key on your keyboard to continue. The patient's temperature was taken orally, so click on Oral. Now enter a pulse of 78 and then press Tab. Respiratory rate of 18, then press Tab. Enter a systolic blood pressure of 136, then press Tab to advance to the diastolic field. Enter a diastolic of 78, followed by pressing the Tab key. We'll skip the mean arterial pressure in this example, so just proceed by pressing the Tab key. Blood pressure was taken in the left arm. In the lying position. Pulse ox was 98%. On room air. Remember, in a multi-select box, click on the X to continue. That's all of the vital signs we took on this patient, so let's sign the document by clicking the green check mark. Notice that the data we entered now appears in black font because we've signed it. Be aware that if you document a result that falls in the critical range, a warning message like this will appear. Simply click Yes if you are satisfied with your entry. Similarly, if you attempt to document data that is outside of the range that is feasible for that value, an error message will also appear. In this case, you will need to click OK and then recheck your information to enter the appropriate value. One major advantage of PowerChart is the elimination of double charting information in multiple locations. This benefit also holds true in iView charting. For example, under the Med Surg band, notice the set of vital signs charted at 1057. Now let's look under the ADL band. Notice that the ADL band also has a vital signs section, and those same vitals that show up at 1057 on the Med Surg band also show in the vital signs section under the ADL band. In fact, any band that has a section for vital signs will show all vital signs charted, regardless of the original band under which the values were documented. This concludes Module 2 of iView charting. Please refer to your scenario sheet for instructions on the next set of practice exercises before proceeding to the next module.